Hanson. I'm a chiropractor from Edmond, Oklahoma. I've been practicing for 34 years. I have a large family practice, and a number of years ago, somewhere between 6 to 8 years ago, a mother brought her daughter in for me to work on her back. She was in high school because she was having some lower back problems, and we worked on her for a number of months, and she got much better. And since they were from quite a ways out of town, she ceased coming in. And then I haven't seen her for up until about 2 years ago. She called and made an appointment for her baby. Her baby girl had been diagnosed with an extremely rare colon disease where she had no bowel movements at all. And in the process of diagnosing and testing, they've gone to the extreme of doing a biopsy on this baby's colon, which is rather painful for the mother to endure besides the baby. And they then further diagnosed a rare type colon where they might have to remove part of her colon. So the daughter, in desperation, remembered she'd come to the chiropractor, called me up and asked if I thought we could help. So I says, let me check your baby and see. The little baby girl was about between 2 to 3 months old at that time. Still had no bowel movements. And at this point, I don't remember if we took an x-ray of the baby's back or not, but I think we did a scan on the baby's back. And they lived about, not quite 25 miles away from my office. And I told the mother that the baby had subluxations in the spine, and with some adjustments, I believe we could help it a great deal, because we've had experience working on these kind of situations before. The next day, the mother brought the baby back, and I told me I have to work on the baby every day for a few days. She was a happy mom, because she says her baby pooped on the way home, and pooped the next day. So she was a happy mom with a pooping baby. So I worked on the baby a number of times to get the spine normalized, and she was functioning normal. And about 6 months later, that was like in November or December, and then in June or July, she referred another lady that had a baby that had the same problem. The baby Ryan was born at 1 pound, 8 ounces. And of course, he was in intensive care for a great number of months. The mother stayed with him. She was also, I believe, from the same town that Lisa was from. Erica. And it was a great hardship on her to be there all the time with her baby, but she survived that. Erica told her to call me and see if we could help her baby. So this little bitty baby Ryan, when I saw him, was just a little over 6 pounds. When I saw him at about 4 or 5 or 6 months old. And fortunately for baby Ryan, I think it was about the 3rd adjustment after we started, he started having bowel movements and continued such. I worked on him for about 3 or 4 months. And both moms have pooping babies and are very happy. And since that time, both of the mothers have referred a number of other babies with the same problem to our office. So that's our miracle story about baby Ryan. The obstetrician that was in charge, the neonatal doctor that was in charge of the baby, is a patient of ours, severely hurt his back and wasn't able to practice, and is now practicing. He's referred his wife and 3 children to our office. And so the miracle there is primarily baby Ryan, but from those instances, many other people have come under chiropractic care because of baby Ryan. And the doctor that delivered her brought the picture of him holding the baby right after it was born, and he took his ring finger off and slid it on baby Ryan's leg up to his thigh. That's how small baby Ryan was. And that's what the mother took a picture of that and sent it up to us as a Christmas card of how our baby was and how it is now. So that's our baby Ryan miracle story.